Hi, I'm Dr. Ginni Chhabria, consultant dermatologist and cosmetologist practicing in Indore since past 10 years. I will be discussing about hyperpigmentation, which is a common skin condition, its causes and its prevention. So, pigmentation or hyperpigmentation is a condition that occurs when the production of pigment called melanin in our body becomes unusually high. It affects people of all skin types. Now, melanin is a pigment that gives our skin, hair, eyes their color and is produced by a cell called as melanocytes. People who have darker skin color will have more melanin in their skin than those who have a lighter skin tone. Higher production of melanin causes skin problems such as dark spot, dark patches, uneven skin tone and dark circles. Hyperpigmentation can affect people differently. In some cases, it might appear in smaller patches and some people might have larger areas covered, and rare cases, dark spots might pop up all over the body. In most cases that I have come across, hyperpigmentation happens mostly to women, although men can have this skin problem too. Generally, there is a lot of misconception among people on why you get pigmentation and what one can do to look after the skin. Both external factors such as UV exposure, pollution, and internal factors such as hormone and aging play a role in hyperpigmentation. So, before starting any form of treatment, we need to find out the exact type of pigmentation. Some of the most common ones are melasma, which is mainly due to the hormonal changes. It can affect both men and women, and it is more commonly seen in women during pregnancy and mainly seen on the face. Another type of hyperpigmentation is sunspots, which are a direct result of increased exposure to sun. These are also referred to as liver spots, which appear on face, back of the hands, on chest, mainly parts of your body that have a direct contact with the sun rays. Hyperpigmentation can also be seen after injury or skin inflammation, and it is known as post-inflammatory hyperpigmentation. Hormones, sun exposure, inflammation are the main causes of pigmentation. These three factors play a big role in pigmentation. In India, with our climate, most of us are exposed to the harsh sun, which can cause skin damage. The greater exposure to sun, the greater you are at risk of increased skin pigmentation. This happens because being in a direct sunlight for long period makes your melanocytes more hyperactive, which increases melanin production, causes hyperpigmentation or dark patchy skin. Other factors that can cause hyperpigmentation are taking oral contraceptive pills during pregnancy, which can alter hormonal levels. If you have a darker skin type, then you are more prone naturally for pigmentation. If you have had some injury or trauma to the skin, say burn, wounds, they can increase the pigmentation. Certain drugs which increase sensitivity to sunlight can be other causes. Also, allergies or stress play an important role in causing hyperpigmentation. Unfortunately, it is not always possible to prevent hyperpigmentation, but you can protect your skin by wearing cap and long sleeve cotton clothes that limit the direct contact of sunlight with your skin. Avoid going out between 10 a.m. to 4 p.m. during the day, as the sun rays are harshest during that time. Use a good SPF sunscreen, minimum 30 without fail if you have to go out. Avoid picking at the skin to prevent hyperpigmentation forming after injury, and avoid picking your spots, scabs and acne. When a patient comes to me with hyperpigmentation problem, the general procedure is to diagnose the skin condition by getting a proper medical history accompanied with a detailed physical examination. In some of the cases, the problem is treatable with prescription medicine which contains hydroquinone, which is a skin lightening agent. Although I do not recommend prolonged use of hydroquinone, as it can have adverse effect on the skin. Some safe topical treatments that can be used for long term include ingredients such as azelaic acid, kojic acid, retinoids, vitamin C. In case where the prescription medicines do not work, then the treatment methods such as chemical peeling, mesotherapy, laser therapy are recommended. A chemical peel is a skin-friendly fruit solution that removes the damaged outer layers of the skin and is mostly used on the face, but it can also work on neck, hands or other parts of the body. It is a safe way to revitalize and enhance the appearance of skin which is damaged, dull, wrinkled due to sun exposure, acne and aging. Another treatment method which is effective in treating pigmentation is known as mesotherapy, and it is a combination of vitamins, skin lightening agents, brightening agents which are infused in the skin to treat the dark spot and stubborn pigmentation. A popular choice for treating hyperpigmentation is intense pulse light known as IPL, which involves light-based energy pulsed onto the skin to fade the dark areas. Hyperpigmentation is generally not a harmful or a serious condition. In my years of experience treating hyperpigmentation patients, I have realized that each case is different and it needs a separate approach. In some cases, the dark areas fade on their own with just a good use of sunscreen, whereas some cases require a proper treatment by a dermatologist. I hope this information has addressed your queries about hyperpigmentation.
To book an appointment with a cosmetologist or a dermatologist in your area, please visit www.skinandhairacademy.in.